Hi, you guys. Thank you. I am super excited to be here today and talk about something that is very, very near and dear to my heart, and that is person-first language. Is anybody in here familiar with person-first language? Other than this table. That's my coworkers. Love them. Okay, well, let's get started. Reflecting on your experiences in this room, I would assume that most of you are advocates, people in recovery, you're working in the recovery industry. And I want to ask a question. Have you ever felt stigmatized when someone is talking about you or to you? Raise of hands. The whole room, right? What did you feel like? What was said to you and how did you respond? I want to tell you a story about somebody that is very close to my heart that I love dearly. And this woman was an amazing athlete. She grew up in a single-parent home. She was genetically predisposed to substance use disorder and alcoholism. She suffered from codependency from a very young age and a lack of self-worth and a lack of self-love. At the age of 22, she found herself leaving a domestic violence situation. She had 2 children under the age of 2, and she was living in her car without her children, without any income. And just before turning 23, this person decided that she was no longer going to be labeled as just a drug addict. This person is me. And at 22, just shy of 23, I had lost everything. And I didn't lose it, I gave it away, right? Because I let the labels and the stigma define what my life was going to look like. There was a lot of trauma that had not been dealt with. There was a lot of things that I remember being said to me the night that I decided I was going to do something different. I was told, "You're just going to die a junkie." And if you cringe at that word, good, you're in the right place. Because I do too. When I hear terms like, "she's just an alcoholic," or "he's just a drug addict," or "I'm just a junkie," or "hi, I'm a crackhead," right? I hear those terms frequently working in the industry that I work in, as some of you probably do as well. When we talk about stigma, stigma is defined as a mark of disgrace associated with particular circumstance, quality, or person. The stigma of having gone to prison will always be with me. That's not accurate, right? We have the ability to change our lives. We have the ability to recover, but it's going to take some work. Stigma robs people of rightful life opportunities. It interacts with illness and exposes people to distorted experiences with criminal, mental health, and medical treatment. Stigma leads healthcare systems to withhold appropriate services. Does anybody relate to any of that? Have you ever been withheld medical services? You didn't know where to go for treatment? Me either. What is person-first language? Person-first language is exactly what it says, right? Putting a person first before a diagnosis, before any deficits. It recognizes that we are not to be identified by things that we've suffered in our life. The language we use influences and reflects our policies and approach to addiction. Different terms convey different meanings and can affect perceptions, cause, and controllability, punishment, and/or treatment. It can implicitly affect judgment that can perpetuate stigma and discrimination against addicted individuals. There is no right or wrong. It is about what is effective in a setting. And I think that that's an important thing to touch on because in 12-step programs, which is where I originally got sober, you often hear people introduce themselves by saying, "Hi, my name's Mersades and I'm an addict." That's okay, right? We have the right to autonomy. We have the right to introduce ourselves in whatever the comfortable norm is in that environment. But it's also important to remember that outside of those rooms, how we introduce ourselves, how we talk about our story is going to be absorbed by those around us. And so when I'm in public, I don't introduce myself to my mortgage broker and say, "Hi, I'm Mersades, I'm an addict." And then it goes, "Ugh, are you gonna pay your mortgage?" I do, right? I pay my mortgage today. Oh my God, I'm a homeowner, right? Things that I never thought possible 6 years ago. I remember getting my license and being a legal driver. I remember getting insurance and having registration. And I was like, this is it. I've peaked. I've made it, right? Someone pull me over. I dare you. And I was so excited for that moment. And they just kept coming, right? Things just kept getting better because I continued to do the things that was changing my life. Words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. And that was by Don Coyas, who I just saw speak, and he was amazing, by the way. Polling on recovery. This was given to the general public, and what they saw was a majority of Americans have been affected by addiction, and that was 63%. Whether that was themselves, a family member, a friend, someone that they cared about, 63%. That is over half of the population. A majority at 67% believe that there is a stigma towards people in recovery. A majority of 74% say that attitudes and policies must change. That is non-negotiable. People are dying and they don't have to be. This is something that was just touched on by the keynote speaker, and I love that he brought up, my friend did not have to die for me to recover. And I think that that's so crucial, that we all have the ability to do something different and to save somebody else from thinking that they are defined by what labels they've heard in their life. 88% of the recovery community believe that it is very important for the American public to see that thousands get well every year. People are people. I think that that's so crucial to remember, right? I hear things, again, I'm just an addict or I'm just an alcoholic. Is there any other disease that we go, God, she's such a cancer, right? Or he is such anxiety. I might say that about my kids, but, or he's just dementia, right? There is no other medical disease that we refer to somebody as their disease. Yet, in the recovery field, we hear people all the time say, he's an alcoholic, she's an addict. And we have the ability to change that just with our words. So some of the current terminology you'll see listed here, clients, patients, consumers, preferred terminology, person first, right? The individuals in our program, the people we work with, those that we serve. The reason, it is more inclusive. It allows people to feel that we are a whole unit working together and not that we are just there to serve them. Because most of us here in this room are likely peers, right? Certified peer support specialists. The commonality that we share is that we have lived experience, is that we have the ability to speak on what we've done to change our lives. Oof, this one gets me. The homeless, right? Do you hear people say that all the time? Oh, they're homeless, or that's a homeless person. And it just makes me cringe because we're identifying them as they're just homeless. That's a homeless person. But what we're not saying is that they're currently displaced, right? That's an unhoused individual. That's someone who's seeking housing. Because homelessness is not at all something that you use to describe somebody, right? There are so many things that make up the parts of who we are. I'm a mother, I'm a wife, I'm an avid fake tanner. I love to play softball, right? I'm probably too loud a lot of the time, but there's all of these different parts, and to me, I am made up of 200 different things, if not more, right? To my husband, I'm probably made up of 500. But we all have so many things that create our identity, and it's not one of our deficits. We know that addiction, substance use disorder is not a moral failing. Mental disorders are not adjectives. I love this picture because we hear, oh, you're just being so bipolar, right? You look anorexic, you're so skinny. And I'm somebody that has not had the healthiest relationship with food for most of my life. That's something that I've had to work on. That's something I've had to work on compassion and self-love and self-worth and trying to take care of all of these different areas in my life. I'm someone that suffers from depression. I'm someone that deals with anxiety. I'm shaking right now. And that doesn't identify who I am as a person in one word, right? Because I'm so many other things. And so if you take anything from this picture, it's that I hope that you're more mindful when you're speaking about yourself and when you're speaking to your peers, because we have the ability to cause ripple effects in our community. And there's number in powers. There's power in numbers, however that saying goes. Research on language, a study on terms. So there was an amazing study done back in 2010 by John Kelly from Harvard, and some of him and his coworkers got together and they took a massive group of physicians and clinicians and psychologists, and they got this caseload together and they said, we want you to review this caseload and we want you to answer some questions for us. And they said, okay, yeah, we're happy to do that. And they said, this person is a substance abuser. Answer these questions. They said, okay, and they did, and they went through and they said, okay, here's another case study. This person suffers from substance use disorder. Answer these same questions. And this is what we saw. When the term substance abuser was used, they were less likely to benefit from treatment. They were more likely to benefit from punishment. They were more likely to be a social threat. They were more likely to be blamed for their substance-related difficulties and less likely that their problem was the result of innate dysfunction over they had no control. They were more able to control their substance use without help. The other person, in having a substance use disorder, we can see the scale here. So we've got in dark blue, substance use disorder. Do they deserve treatment? 69%. I want you to review this graph here and see how drastic those numbers are. The only difference was the terminology that was used. It was the exact same case files. We look at self-regulation. 67% of individuals that have substance abuse should be able to self-regulate, right? But they're not. Substance use disorder, only 33% can self-regulate. They need support, right? They need treatment. They are not a social threat. They do not deserve blame. This is not their fault. The only difference is the term that was used. Why is this problematic? We're talking about doctors, psychiatrists, clinicians. These are people that in our communities we feel a sense of trust because they're educated, right? Because they know what to do when we don't. Do they? Do they know what to do? I think it's really, really scary when we look at the idea that one simple terminology, substance abuser, substance use disorder, can so drastically change the way that people are treated. They deserve punishment. They don't deserve treatment. They should be blamed. They can't self-regulate. That's terrifying to me. I had an individual the other day came into my office, and we've been working a lot on advocating for yourself, right? You can lead a horse to water, but you can't make it drink. And so there's so many things that have come up where, I felt a certain way about this, and she's felt a certain way, and so I've really been focusing on empowering her to say what she needs to say. She comes to my office and she says, I had a doctor's appointment, and I'm going to filter what was said because professionalism, right? And she said, and my doctor, I went in there, remind you, this individual recently had her femur broken, she's had a hip replacement, I mean, she's just half bionic. And she said, you know, I went in because I'm having this pain, and the first thing my doctor said to me was, I'm not prescribing you pain pills. And I said, how did that make you feel? Tell me more about that. And she said, I was so angry because I didn't go in there for pain pills, right? I went in there for answers. I went in there to get help because I don't know what to do. And I said, so what'd you say? She said, so I walked out. I said, okay, are you ever going back? She said, well, I don't want to, right? I don't want to go back there because I felt so judged and I felt so stigmatized and I didn't feel safe. But I have an appointment next week. Where I live in rural Utah, if you are familiar with Carbon County, it is very, very small. There is one hospital. So she doesn't have an option, right? And I said, okay, well, let's role play. Let's talk about what you feel comfortable doing at your next appointment. She says, okay, so we go through this exercise and she comes and sees me the next week and she says, I just gotta tell you what happened. And so I'm bracing for impact, right? Because I don't know what happened. This is Price, Carbon County, 50 years behind the times in Utah. You know, everything shuts down at like 9 o'clock in the afternoon on the weekends. And so, you know, we were talking and she says, so the first thing I said to him was, I'm not here for pain pills. Why would you think I am? And she made him answer the question. And he said, well, I looked at your chart. And she said, but I'm not my chart. I'm not the woman I was 2 years ago. Today I'm here because I need help and I need support. And she ended up getting the help and support that she needed because she simply advocated. And I am such a person that has a crush on motivational interviewing, right? I love it. And I said, so you put it back on him? She said, hell yeah, I did. I said, good, right? That's important because the way that we reduce stigma, the way that we can break those labels is by saying, tell me more about that. Tell me why you feel the authority to address me that way. Because I'm not that person, right? I'm not who I was even 30 days ago. And if you knew me 6 years ago, bless your heart, right? Because it was a lot. It was a lot. And some of you probably did. And I'm so glad that you can see me here today and be like, wow, it's possible, right? So some recovery positive vocabulary. You see here commonly used terminology and preferred terminology. I think these are really great things to touch on. At USARA, where I work, which I am so grateful that I have the opportunity to be here representing USARA. Before I worked there, I was not aware of person first language. And I had the ability and the willingness to be teachable, right? Because every single day I'm learning things that I didn't previously know. And so it's not ignorance that we see in our community most of the time. It's just lack of knowledge, right? And so it starts with us educating those around us, because if we set that example, others can then follow that. And it can be so empowering when we no longer have to identify ourselves as, hi, I'm Mercedes and I'm an addict. Because today, I'm Mercedes and I'm a woman in long-term recovery. And what that means to me is I don't have to put drugs and alcohol in my body anymore, right? I have the ability to walk through life because I have coping skills, the ability to communicate, the ability to advocate, and the ability to call people out on their bullshit if I have to, right? That's not things I was doing 6 years ago. Sorry, Heather, for the swear words. But some of these up here, relapse prevention. I'm not a fan of the word relapse because when I hear relapse, I think, oh, it's happening often, right? I prefer the term instance of use because it can be an isolated incident. I hear people often say, relapse is just a part of recovery. What? It doesn't have to be, right? Because I had somebody once come to me and say, I was in treatment and my therapist said to me, relapse is just a part of recovery. So I went and used. And I thought, what the hell is happening? Right? I said, well, glad you made it back. Welcome home. Because there's a lot of other people that don't, right? One is too many and 1,000 is never enough. And the way that things are right now with fentanyl, you never know if it's going to be somebody's last time. And I have lost a lot of people in the last 6 years. A lot of people. And that's why I continue to do what I do, because every single person matters, right? Every single person is somebody to somebody. When we talk about suicide, we have some commonly used terminology here, and then some preferred terminology. I think that often we hear things that have been a social norm. Oh, they committed suicide. To me, that sounds like, well, they chose to do it, right? They committed a crime. They committed a sin, right? And it's so incredibly stigmatizing, and it's so shaming to the individual that has lost their life. And I can't imagine how it feels for the family. Well, I can, because I am somebody that has lost somebody to suicide. And that is part of my story. When I was 16, I lost my stepdad to suicide. And everybody felt so bad for me, right? Oh, he killed himself. That must be so hard for you. Hell yeah, it's hard for me, right? I was 16. I didn't know how to deal with any of that. So what did I do? I numbed my feelings with drugs, alcohol, relationships, all of the things, because I was an equal opportunist and I don't discriminate. But when we talk about suicide, the loss of somebody, it's important to be mindful to use empathy. Because just like suicide, just like substance use, it affects everybody around you. Your message in putting a face and voice to recovery. I am a person in long-term recovery, and what that means for me today is some examples, right? Today, I don't put drugs and alcohol into my body for many reasons, but mostly because I have the ability to live my life without drugs and alcohol today. I get to show up for things that I previously didn't have the opportunity to show up for. I get to be a mother to 3 children whom are the best things in my life, right? I talk a lot of smack on them because they talk a lot of smack for little kids that are totally dependent on me, but they're little tiny versions of me running around, so like, of course it's chaotic in my house. But I get to do all of these things, right? Because I don't put drugs and alcohol into my body. I know we hear all of these cliches in the recovery community, right? Just one day at a time. Fake it till you make it. No, face it until you make it, right? Deal with it because it's not going anywhere. And that is part of why I numbed myself for so many years, because I thought, oh, someone else will take care of it, right? Or eventually it will get better. And I was in a therapy appointment one day, and I was really, really struggling with some of the ups and downs that came with my depression. And I said, I can't do any of the basic things that are needed of me, right? Feelings of inadequacy, I'm not a good mom, I can't even bring myself to do the dishes. If you know me, if my husband is watching, which he probably is, I will not go to bed with dishes in my sink. Why? because it pisses me off the next morning when I see it, right? Not because I'm a clean freak, because I am a cluttery person. But when I wake up and the first thing I see is a bunch of dishes just calling out my name because I'm the only one that's going to do them. If my husband is watching. It pisses me off. So I go to this therapy appointment and I say, I can't even do my dishes. And my therapist says, why? It's because I can't bring myself to rinse them all off and put them in the dishwasher. I can't do it right now. And he said, so put them in the dishwasher and run it twice. And I thought, oh my God, your college education has paid off. Are you kidding me? It was that easy? Like, I can just run it twice? Is that acceptable? And he said, to who? Who cares if you run your dishwasher twice? I said, I can't take a shower. I can't do it. I'm sorry. And he said, why? Because I don't want to stand in the shower. That's why. He said, so lay down in the shower. Are you kidding me? Okay, here we go. Let's be solution-based, right? Let's figure out how we can do things even if it's one baby step at a time. So when I say, hi, I'm Mercedes and I'm a person in long-term recovery, that is my baby step today, right? Because I don't know where I'm going. I don't know what I'm going to do in this life. But I know where I've been and where I sure in the hell don't want to go back to. And for me, I'm willing to do whatever it takes to make sure I don't go back there. What's not in the message and why? Again, some troublesome topics. Addict, alcoholic. It conjures a negative image, right? We go back to, have you heard anybody be referred to as a cigarette addict? Right? No, because that's ridiculous. That is ridiculous. Memberships in a 12-step program, they endorse a specific recovery path, potentially violates the traditions of these programs. I think when we talk about pathways to recovery, something that I've learned at USARA is that we believe in all pathways to recovery. My story is not anybody else's story in this room. It's not any better. It's not any worse. But what that means today is that what works for me is probably not going to be the exact same thing that works for anybody else. And it's important that in peer support, we recognize that just because something worked for us does not give us the right to push that onto anybody else. Because for some people it's nature. Some people they're like, I just need to go hike. Ugh, oh my God, what? I freaking hate nature. I hate hikes. I hate it, right? Tiffany, I'm looking at you. You know, people that are like running, that's my thing. I'm like, oh God, you know, in my head. Because I can't imagine. Rachel just invited me to a 5K and I was like, ew. No. Thank you, but no. I would very much rather not participate in a 5K, right? Do you have a defibrillator? Because I'm skinny, but I don't do anything, right? That's not my jam. That's okay. I'm more like, let's meditate. Like, I want to go on a hike, but I want someone to carry me there, and then I want to look at the sunset, and then I want to ride a sled down. That works for me, right? Some people in here are like, no, I love hikes, right? I love running. I love exercise. Ugh, you know, that burn, I wish I loved it. I'm envious of you people in here that's like, that's my go-to, the gym. I love it. It's how I cope. I wish I loved it. I don't. I hate it. It's miserable for me. We were walking down the stairs just now, and I said, where's the elevator? And I thought, gosh, you better shape up, sis. But I wear big shoes because I feel like it burns extra calories, right? It takes more work in my legs to walk. I don't know if that's real, but it's what I justify it with. So we see a change in attitudes. From the 1980s cocaine epidemic to now we have the opioid epidemic. And at this previous conference that I attended where Don Quayes was a speaker, we had another incredible speaker, and he talked about the opioid epidemic. Why is it just now being declared an epidemic? Because people have been dying for a very long time, right? And what I was told was, I say this as kindly as I can, because now white people are dying, right? Because before it was primarily African American, Latino, but now it's invading the suburbs. Now it's reaching all areas, so we have to declare a national epidemic. And I think to myself, in the 6 years that I've been in recovery, I have lost more people than I can count. And I'm only one person. So every single person in this room that has lost 5, 10, 15, 20 people, that's a massive amount of people that we did not have to lose. In 1987, substance use disorder was officially reclassified as a disease. Our language, unfortunately, has not kept pace with that. So we have had progression, and that's wonderful, right? But not enough. So what we see in the 1980s, when there was the cocaine epidemic, we see headlines like, crack, a disaster of historic dimensions still growing. A time bomb in cocaine babies. How horrifying. Cocaine babies. I have a baby. He's still a baby. He'll be 2. He's still my baby. He is the light of my life. He's my little Mr. Briggs. And everybody calls him Mr. Briggs. I don't know where the nickname came from, but I know he's going to grow up and think his first name is Mr. It's not. And he calls me Dad. I don't know why. It beyond pisses me off, right? He calls his dad Dad too, but I think he just knows that it bothers me. So I pick him up and he goes, Dad! And he runs to me and I'm like, I do everything for you. How hard is it to call me Mom? You know, but he won't. Occasionally he will, and I look at him and he goes, Dad. Is this real life? Right? I'm so offended. But I think about back when the cocaine epidemic was happening. And if somebody said that my baby was a cocaine baby, we'd be throwing hands. Right? How horrifying that something that has nothing to do with who that baby is now how it is going to be identified. Nothing to do with that little tiny person, right? Something that they were passed down that is not at all who they are. That is heartbreaking. So we see now, during the opioid epidemic, how language has changed, not as much as it needs to, but the differences that we're seeing. When opioid addicts find an ally in blue, right? Opioid addicts hate that part. Hate it. But it's better than when junkies find an ally in blue, right? I'm still not going to accept it. It's still not good enough. Cleveland police officers will carry Narcan to help people who overdose. Thank you, person first language, people that overdose. I had this conversation with somebody in a community that was very well respected. And it was in regards to Narcan, because again, where I live, we're very behind times. And Narcan was not always used, right? And this was someone who said to me, I'm not using Narcan on people. If they choose to use, that's on them. And I said, who do you think you are, right? Who's deciding who's worth saving, who's worth giving another opportunity to? Because I'm an individual that has had Narcan used on them. My face is plastered on State Street, right? In one of those Utah naloxone billboards. And it changed my life, right? That was not the moment that I said, this is it, I'm surrendering, I'm throwing my hands up. But it gave me the opportunity to let those seeds that were planted bloom. And it took a while, right? But if I wouldn't have been given that opportunity, I wouldn't be standing here today. And I wouldn't have my 3 kids, right? I wouldn't have little Mr. Briggs, who I miss so much right now. But I get to, because the person that distributed Narcan to me didn't hesitate and say, is this your first time? Have you done this before? I don't know if you're worthy of Narcan, right? Are you a drug addict? Are you a junkie? They said, you know what, this is a life. And it matters. Because I'm someone's daughter, I'm someone's sister, I'm someone's wife, I'm someone's mother. And I get to have those relationships today because I was given that opportunity. And I was given the opportunity to change my life. Addiction recovery is social justice. All oppression is connected. There is no such thing as a single issue struggle because we do not live single issue lives. It's important to recognize that I did not get where I am today because my life was wonderful, right? It wasn't terrible. It wasn't as bad as it could have been. But the difference is I didn't have the resources. I didn't have the connection. I didn't have the ability to reach out for fear of judgment, shame, rejection. And I grew up in a single family home. My dad's from Chicago, born and raised. So if that doesn't give you a descriptor, he has a flat top haircut. He was a military man, and his haircut has not changed in 30 years. And I was raised by my dad, and my biological mom was in prison. And I used to get my haircut at the barber shop, right? And my dad used to take me there, and there were all these old men, and I was like, will you give me $1 if I sweep up the hair? You know, all of these weird memories that daughters usually have a mom in the picture. I didn't have my mom in the picture, and so I didn't ever feel like I had somebody to talk to about those things. And I was so scared to talk to my dad because in my home, we didn't talk about feelings. And this table right here knows I don't hug people. I'm not a hugger. Everyone in recovery is a hugger. Oh my God, right? It's so weird to me. I've gotten more used to it now. It took 6 years. But when I first came into recovery and everybody started hugging, I was like, don't you dare come near me. I was so freaked out. And then I quickly realized that that's how everybody was showing their love and their support and their connection. So I let people hug me on occasion, right? Like a couple times a year. Tiffany, you've met your max. No, I'm just kidding. But I never had the ability to reach out and say, this is what I'm going through. This is what I'm struggling with. I need support. I need help. I'm confused. I'm lost, right? And it was so difficult because at 17, I tore my ACL. And I got prescribed pain medication. And for a very long time, I did not know that I was misusing pain medication. And I remember the first time I was sick and I was experiencing withdrawals. And I called my dad at work and I said, I have the flu, bring me Gatorade. And he said, okay, I'll be there at 5 when I get off work, right? Because God forbid I had a problem. Or that, you know, I was predisposed to this genetically from both sides of my bloodline. And so I hid it. I hid it for a long time. And I'm not from this area, right? I grew up in Brigham City. If anyone knows where that is, it's kind of by Ogden. It's tiny too, bigger than Carbon County, but it's still very small. And I think they have maybe 2 AA meetings. People don't talk about substance use disorder. People don't talk about recovery. And I remember when I finally went to treatment, and it was the only time I think I've ever seen my dad cry. And he gave me a one-armed, weird, awkward hug. And he calls me Buddy. I'm a mom of 3, but he calls me Buddy still. And he says, all right, Buddy, you got this. And I said, okay. And I went on my way, right? And I remember thinking, I just can't do drugs. And then I'll just be normal, right? If I just don't use drugs and alcohol, I can get out of rehab in 30 days, and then I'll be normal. Whatever that is, right? And I went to treatment, and I did everything the exact opposite of what they told me to do, because that's who I was as a person. They were like, don't get in a rehab romance. And I was like, I've got 3. And they were like, you need to go to these meetings and be honest. And I was like, I'm Mercedes and I don't have a problem. And then I left with a staff member, got him fired, lived at his house for a couple weeks, like, didn't have anywhere to go, right? Because my dad said, you didn't finish. I'm keeping your babies until you're better. And I just forked out $35,000 in my retirement for you to go to treatment. And you left with a staff member. And I said, well, I didn't leave with him. He called me a taxi. And he said, where are you staying? I said, well, at his apartment. And then he got sick of me, right? This guy that I don't know, that I trauma bonded with, was like, dude, this just isn't working. And I was like, shit, where am I gonna go? So I got my car, and I lived in my car on the streets of Salt Lake. And I stayed sober because I knew that people in the program wouldn't let me sleep on their couch if I wasn't sober. And so I hopped around from place to place until I could get into a sober living. And I remember thinking, is this what recovery is? This is so hard. How do I do this, right? And then I finally started listening to people around me. And I started taking suggestions. I still had lots of romances. It wasn't great. It was still very chaotic. And then finally I got sick and tired of it, right? We hear it all the time. You've got to get sick and tired of being sick and tired. Rock bottom is wherever you put the shovel down. And I was so scared that for me, rock bottom was going to be death. Because it felt like I had a magnet in my hand to that shovel. Because if I wasn't using drugs and alcohol, I was using everything else that was bad for me, right? And finally, there were women around me that said, I'm here for you, I care about you, you matter. And I thought to myself, okay, it's now or never. You either latch onto these people that are doing the things that you want to do, or you leave this legacy behind for your children. And not dying is not the same as living, right? Because for a long time, I stayed in this place of limbo where I wasn't dying, but I also wasn't living. And so when they said to me, you are not just a drug addict, you are not just a junkie, right? You are not just a heroin user. You are a mother, you are a friend, you are a daughter, you are strong, you are smart. There are so many other parts of you, but you've got to remember those other parts too. And if you don't know where they are, you've got to find new parts. And I said, okay, what I'm doing right now is a dumpster fire, so what do I have to lose? And I latched on, right? And I started to see things shift in my life. And at some point, about a year later, I had my kids back, right? And they were barely 2 and barely 3, because my kids are almost exactly a year apart, because I go hard in everything I do, right? So like little tiny babies back to back, send it. I liked the chaos. But then all of a sudden I was a woman in recovery with 2 tiny children, working in a tanning salon, and had no idea how to do any of it. And so I latched on to the people around me, and that made all the difference. People are people, and they should be treated as such. We often see this picture in ethics trainings, and what we don't see is the last picture of liberation. So when we look at this and we see the reality of what things look and feel like, right? An individual that doesn't struggle with mental health, that doesn't struggle with substance use disorder, stacked high on boxes, can see the game. An individual who maybe struggles with some things but not everything, they're just over the fence. But then you've got us. Maybe we have co-occurring issues, right? Substance use disorder, mental health diagnosis. We're not only not able to see the game, but we're in a hole. I don't know about you, but I like to dig holes and then stand in them. That's the kind of person I am. Can this get harder? Let's see, right? What is equality? Putting everybody on one box, right? Giving them all the same options. But they can't all see the game because they don't all need the same thing, right? And that goes into the importance of all pathways to recovery, person-first language. We don't all need the same thing. We're not always going to walk the same path to get there. Equity. We've got 2 boxes. You're so close. You can almost see, right? We're going to focus on what you need and not anybody else. So they can all see the game. But what do we really need to do? We need to liberate them and remove the goddamn fence, right? Why is there a barrier there? Why are we having to jump through hoops? If I had to jump through that many hoops when I first asked for help, I probably wouldn't be here today. And I see this often where I live. We don't have inpatient facilities. We have 2 outpatient services. And it is so difficult when somebody says, I need to get out of here, I need inpatient services. Where do they go? right? Well, I need you to do this, and I need you to do that, and I have to write a letter to your probation officer to ask them to put you in jail so we can enroll you in open marketplace, and then we can change your insurance, and then we can get you in treatment, and then it'll only cover X amount of days, and then you gotta come back. But hopefully that 30 days works for you. What is the likelihood of someone being successful? Don't even get me started on how hard it is for individuals that are unfunded, that are uninsured, that don't have the ability to get to those resources. What we do at USARA is bridge so many gaps, and we provide peer support services. We're a recovery community organization, and it's the first time that my area has ever had anything like that. I cover 2 counties. I have a very large caseload. And it's the most beautiful thing that I've ever done, because I feel that I'm making a difference for people. That's why I work in peer support, because when I reached my hand out, somebody reached back, and that saved my life. And the work that we do is so crucial in making sure that people don't feel alone, and they don't feel stigmatized, and they don't feel judged. Because, hey, I get it. If we sat in a circle and talked about all of the worst things that we've ever experienced or gone through, we would probably laugh at the lack of authenticity, right? Because I've been there, you've been there, she's been there, he's been there, I've done that, we've done that, oh my gosh, how embarrassing, right? But it's not, because when secrets are told in safe places, they lose their power. And so when people can really lean into that non-judgmental support, and we can do things like use person-first language. You are not your diagnosis. You are not just a schizophrenic, right? You are not just a drug addict. You are a wife, you are a mother, you are a daughter, you are a person before you are anything else. And having a substance use disorder or being a person in recovery, that's the least interesting thing about me today. Because it's not who I identify as. I identify as so many other things. Our call to action: if you have found recovery, consider giving the community your story as an instrument of hope and healing. If you have been blessed by resources that helped you find and sustain recovery, then join the fight to expand resources for those still suffering. That is what peer support is, right? And I love that we touched on the keynote speaker of telling our story in a way that's impactful to individuals and knowing your audience. I'm not going to get up here and say, well, this all started back when I was 3 years old, and here's all of the things that happened to me, and that is why I am the way that I am. Because yes, those may be true, right? Those things did shape my life and give me a lot of things that I had to work through in therapy. But that's not who I am. Our recovery stories are not linear. There are so many pieces to it. There are so many ups and downs, but that doesn't shape us and give us our identity. So today I don't focus on, how did you get here? I know how you got here. You all got here because things sucked, right? Like, I did not land in these rooms because I was like, I'm killing it at life. Like, I'm doing great. I got here because I was like, I'm throwing my hands up. White flag is waving. I don't know what to do. Somebody, please help me. And I was met with so many people that said, okay, I will help you because somebody helped me. And so that ripple effect, right? We get to impact so many people even without our knowledge. So when we share our stories, I identify as a woman in long-term recovery because to me, I have no limitations today. I am recovering from so many things, and substance use disorder is only one of them, right? I'm recovering from codependency. I'm recovering from lack of self-love. I'm recovering from lack of self-worth. And it's an everyday process. It doesn't happen overnight. It doesn't even happen in 6 years, right? It's a process. I have my references and resources here for anybody that is interested. And I just want to open it up if anybody has any comments, feedback, questions.
I do.
Yes.
So when you said that when you were in treatment, or somebody at some point said relapse is a reality, that's terminology that I've commonly used, and so I never really viewed it the way that you presented it. So how would you go about having those conversations in a residential treatment?
Yeah, that's a great question. So I often, when that conversation comes up, because relapse has been a big part of a lot of people's story, I think it is dependent upon the person you're talking to. If there has been a relapse that's taken place, I think it's okay to say, sometimes relapse is a part of people's story, but it doesn't have to be, right? It doesn't have to continue, but you have to put in the work. You have to do things differently, because the only way through is through. And things aren't going to change if you're not willing to change them. So a lot of it is just being mindful of the language that we're using in relapse is a part of recovery, or relapse can be a part of recovery. And so it's just the simple shifts there. You're welcome. Anybody else? Yes.
First of all, I just want to say thank you for you sharing and choosing to be a helpful voice.
Yes, thank you.
So I love the first person language, and I think it is important that change is made. What I'm curious about, and it's not really a question, it's just me stating it, is if those new ways of phrasing different, recovery vernacular, is that going to be, I wonder if that's going to become stigmatized someday. If people do make that switch, and we should, I'm just curious if those words are going to become stigmatized through use.
Yeah, that's a great comment. I think maybe, right? We can't predict what's going to happen, and there's always, always, always going to be new things to learn. There's always going to be opportunities for education, and still today, I probably misuse some terminology, and thankfully I have people around me that say, hey, wait a second, and they expand on it. And I do it all the time, and I know it drives people crazy where I live, because I'm constantly educating people, because I think it's important. But as time goes on, yeah, things might change and there might become more appropriate language, but then we have the ability to educate ourselves at that point in time. So I just think it's really crucial that we take the opportunity to say, hey, I'm willing to learn. I'm not going to get offended if somebody corrects me and gives me the opportunity to learn more on how to be compassionate, how to be empathetic, how to better show up for somebody, because that's why we all got into this field, right? And so, yeah, it probably is going to change, but I'll make a new slide when that happens. Thank you. Anybody else? Yes.
How do you remove the stigma and not remove a person's responsibility?
Yeah, that's a tough one. I knew when you raised your hand it was going to be a tough question. I think a lot of that depends on the rapport that's been created. By using person-first language, we're able to address an individual as an individual and not their diagnosis, but that doesn't necessarily mean we're enabling them to not take accountability, right? So in my experience with meeting with people, again, we have total autonomy. So if they choose to say, I identify as an addict, I identify as an alcoholic, that's fully up to them. But there's always the opportunity to say, tell me more about that. Tell me why. And then if it becomes a self-deprecating, shaming thing, then that's where we get the opportunity to say, you know, is that who you are today? Is that what you're working towards? And then usually, light bulb, right? Well, no. Today I'm trying to do things differently, right? That doesn't mean that I don't have this stuff to clean up and this stuff to work on. But today I'm fighting to be a person in long-term recovery. Does that answer your question? Ish, sort of? It was hard. It was a hard one. Anybody else? Great. Okay. Thank you guys so much. I really appreciate you being so